Good morning, everyone. Thank you for joining us today. My name's Zoe and I work for the Zero Suicide Alliance. We thought we'd start today by sharing a quick introduction to the ZSA. So, the Zero Suicide Alliance is an initiative hosted by Mersey NHS Foundation Trust. It launched in 2017 with free, online and accessible suicide awareness training to help people gain skills and confidence to talk to someone that may be struggling with thoughts of suicide. We have since worked with various organisations to introduce different editions of the training, including training for veterans, prison and probation services, university students, taxi drivers, as well as a Welsh translation and an autism suicide awareness course that we launched earlier this year. Collectively, our training courses have been taken over 2.7 million times. In addition to training, we have developed a suicide data map and dashboards, bringing together over 100 indicators related to suicide. Thank you all for sharing why you wanted to join today's webinar. There were a wide range of experiences in this room, so some of you may already know what we're sharing, but we hope you'll all take something away from today's webinar. Some of the content today may be challenging if you have been personally or professionally affected by suicide. If you find any of the discussion today triggering, please look after yourself and reach out for support. We have shared some signposting information in the chat. And if you are struggling at the end of today's webinar, you can also contact us by email and we'll get back to you as soon as we can. Just so everyone's aware, we are recording today's webinar and we will share a recording, certificate and booklet containing the content of the webinar. There will be opportunities to ask questions during the session. So if you do have any questions, please use the Q&A function that you can find at the bottom of your screen. And if you would like to have captions to follow today's session better, you can set this up for yourself using the More option, which is also at the bottom of your screen. So later, our panel will be discussing how we normalise conversations about suicide. Today, we're joined by Alice, Andy and Claire, so I'll just quickly introduce them all. Alice Hendy is the CEO and founder of Ripple Suicide Prevention Charity. In November 2020, Alice lost her brother Josh to suicide at the age of 21. Josh had been researching over the internet techniques to take his own life, and he was not alone. Globally, an alarming 1.2 million online searches linked to suicide occur each month. Determined to ensure more help and support is given to individuals searching for harmful content online, Alice set up a tech charity called Ripple. Ripple is a digital tool designed to intercept online searches related to self-harm and suicide, providing mental health resources to individuals at a time when they are most vulnerable. With millions of downloads worldwide, Ripple is intercepting thousands of harmful online searches, continually saving lives from suicide. So thank you, Alice, for joining. Andy Noon is the head of centre for James's Place, Liverpool. He's a qualified mental health nurse and has worked in a number of clinical settings, including inpatient mental health hospitals across Liverpool. He went on to set up a community interest company, Evolving Mindset CIC, with his brother Phil to provide free and easy to access support for people with mild to moderate mental health needs in Knowsley and across Merseyside. In 2022, Evolving Mindset CIC won the Merseyside Independent Health and Wellbeing Business of the Year, and Andy was nominated for the Rising Star Award at the Nursing Time Awards in 2023. He now works at James's Place, Liverpool, leading a team of therapists providing free life-saving treatment to men in suicidal crisis. Thank you, Andy. And Dr. Claire Iveson is a consultant clinical psychologist and the clinical and strategic lead for Zero Suicide at Mersey NHS Foundation Trust. Claire has over 20 years clinical practice experience working across a range of settings. She is passionate about suicide awareness and prevention, championing evidence-based initiatives and innovative practice. Claire is regularly invited to participate in national and international events, providing expertise and sharing learning and research around safety planning and suicide awareness and prevention. We're really pleased you could join us today. If you do, throughout the session, have any questions for the panel discussion, please pop them in the Q&A function and we'll try our best to ask those questions during the panel discussion later. And final introduction, Steve Messenger is your presenter today. Steve is a registered nurse with over 30 years experience working in mental health. He works with Claire, supporting the implementation and monitoring of suicide awareness and prevention initiatives at Mersey Care. He also provides his invaluable experience and expertise to advise and support those of us working at the ZSA and is also often called upon by us to deliver talks and training on our behalf. I'm going to hand over to Steve now so we can take you through the discussions around the narrative of suicide. Thank you, Steve.
Uh, First off, we're looking through this. We're going to go through the narrative and sort of look at sort of the talking around suicides and sort of how we understand that and how we deliver that. And a little bit of sort of context when we look at it, we're looking here at sold numbers, and we are appreciative that this are or these are people who have died by suicide. So if we look worldwide, there's more than 700,000 people die by suicide in each year. And if we focus that down on the UK alone, we've got more than 6,000 people in the UK who die by suicide every year. So although it's large numbers we're looking at there in the context of everything else, it's a really focused group, and we need to sort of look at how we develop the work around that. Research in the University of Leicester indicated as well that 1 in 5 of us would have some sort of suicidal thought within our lifetime. So it's not something that's just limited to a small number of people. Every one of us will be affected in one way or another by suicide. So we move on and look at sort of the narrative around suicide. We tried to break this down into a couple of different areas. So first off, if we look around the history of suicide and where this narrative has developed from, it's a lot sort of built up around sort of the criminality of suicide initially. In the UK, up to 1961, suicide was a criminal offence, and it could affect a person's family afterwards. If someone had attempted suicide, there was legal implications and everything around that. That's where the word committed suicide has come from, and sort of it's stuck as a general sort of conversation, and that's we want to try and look at how we move away from that in the future and sort of look at that. So we've got all that, the history of it, but in 1961, it was felt that decriminalising suicide and making it more a mental health issue so that people could start to look and seek help would be a better way to address the risks of people dying and taking their own lives that way around. So as part of that, we've had to change the culture and the media aspects of sort of where we move from and how we manage suicide in those sort of areas. Across the world, there is difficulties in managing that. Different cultures, different religions have different ideas around what suicide means and how they can manage that and how they do that within their community. From a media point of view as well, we've got issues with regard to how the media portray suicide. If we look at sort of historical ones, the Carolina Flack, the Robin Williams, the way their suicides were reported in the media, it was very sensationalized, very sort of high profile, a lot of things around it. And at those sort of times, there was potential for people to do copycat methods. So they knew how a person had ended their life, and we were likely to see an increase in suicide methods from similar sort of people following what their celebrities had done. So we had them sort of issues. We've now got a little bit of guidance from the Samaritans with regards how media report suicides. So they look at it a lot more sensitively. They try and portray it a little bit more with regards what support we can have, and we get a positive effect then from any suicides that may come out. Maybe looking a bit like the Graham Thorpe suicide that we saw a couple of months ago, how that was managed. And using that sort of then the stories and experience of people can sort of build in and look at how we can develop an understanding and how we can make people more aware of what they need to do and how they can discussing suicides and discussing the support that is available to them can help and reinforce that sort of part. So it's from them sort of experiences that we build the knowledge and build a bit of education around what we need to do and how we develop our skills. It's now becoming more a subject that is taught in schools to younger children. We are seeing a lot more younger people attempting to take their own lives. So that knowledge and education to that school group age as well should help in the future with people become more able to talk, more able to sort of develop a knowledge, develop a sort of community base where they can start understanding their beliefs, understanding the attitudes of people around and communities around suicide. So those attitudes and beliefs then are building up. We're making the subject a little bit more easier to talk about. We know it's hard, sort of people talking about suicide at the moment and sort of using that phrase, but we've got to break that stigma. We've got to break that taboo around suicide and be able to talk for it. And it's that language then that comes out of those attitudes, those beliefs that people have, and how we talk, and sort of then how people can inform around suicide, how people can talk about it. We know as well a lot of everyday language that people use can be sort of activating to other people and sort of see how they manage suicidal contexts. So we have, as I said, as we started off before, where we have now a lot of people still refer to suicide as someone has committed suicide or is attempting to commit suicide. We've got all them sort of contexts. We want to move away from that. That is criminalising the suicide, as I said before, with regards to the Suicide Act of 1961, that's changed. It's not a criminal offence. If you commit something, it's like committing a crime, you commit robbery. So them sort of parts. So we're trying to move away and say someone died by suicide or took their own life. Similarly, we also have words like successful suicide attempt. Again, that doesn't give a full picture of it. If you're successful in something, normally people focus on something being successful as achieving something. So you're successful in your exams, you're successful in passing your driving test. You shouldn't be successful in taking your own life. That is not a way that we should be viewing suicide. So again, we're looking sort of took their own life, died by suicide. And similarly around that, those who have attempted suicide but has still lived to come through that part. Talking about unsuccessful suicide attempts again makes it look like they're a failure. They were potentially feeling a failure in the first place, which made them feel suicidal. Now we're saying they're unsuccessful at something else as well. So if we talk around attempted suicide, non-fatal suicide attempt, it focuses in on what the actual act is, and maybe that will help bring support. And again, sort of as we sort of discuss sort of the narrative and what we talk, how we talk to people. We say we've got to approach things and talk about suicide as the matter of fact process that it is. So saying things like you're not going to do something silly, are you? Demeans that, makes it sound like you're acting as an adult down to a child and sort of making it them feel a little bit low and everything that way. So we're trying to move again from that. So words like, are you thinking about taking your own life? Are you feeling suicidal? Are the ones that we want to portray and sort of want to get people talking about a little bit more. So we've got all them, we've got that little bit of language of it, but language as well can also be turned and can sort of romanticize a little bit around sort of what suicide is and sort of where we are in relation to the death of a person. So it could be that we talk about someone who's took their own life and has died by suicide as saying that they're now at peace or they're with someone else and sort of ease it. And it may be a case of the way we ease that pressure on ourselves, we ease that understanding of ourselves, that how that is the free from pain now has sort of gone. So what we've got is a little sound snippet here of Jamie, who lost a close friend to suicide around 4 years ago. And he's talking about how he found the language that people talked about and sort of how he struggled with how people talked about the suicide.
I think what was hardest was that I felt bad for being sad about him dying. Saying that he was at peace now made it seem like a good thing, like a mercy for him that he wasn't around anymore. I couldn't understand that because he was my friend and he had his whole life in front of him, really. It almost felt like a bit of a cover-up, like saying he was at peace made it okay that no one closest to him realised how much help he needed. Our whole friend group did, and I guess still does, grieve him, but we had to keep it kind of private and work out for ourselves how we want to remember him. We're lucky that there's a group of us, really, because I can't imagine doing this on my own.
Right, we've got all that. We want to sort of look a little bit around misconceptions now. So we're just going to run a quick poll before we sort of move into the next one. And it's just looking at sort of common misconceptions people have around suicides. Want you to have a look at these and sort of look at any of these that you've seen or heard before people talking around suicide. Just give us a quick vote on these. We'll give it a couple of minutes just for everyone to have a chance to vote on it. But it's things like people saying, "Are you talking about get talking about suicide and that?" And as I say, we'll sort of look at these little bit individually in the next couple of slides. I think it looks like we've got everyone. One or two more people just to go. I think that's enough people now. If we move on to the next slide, we'll sort of look at these. We'd run this this morning, and pretty much the same sort of percentages have run out on each one of these. So one of the top three, the first one we've got there is talking about some suicide will give someone else the idea. We know this, in fact, that this isn't true. Talking about suicide will open that door for that person, will give them that little bit of time to think that someone's listening to me, someone's validating what I feel. I'm now able to talk about it. I'm now able to express my emotions around that and get those things off my chest and sort of start talking about the pain and the trouble that I'm feeling. So we've got them ones. The next one sort of then is talking as people who talk about suicide are just attention seeking. Again, this has come out high on the one of the top three in relation to sort of the poll that we've just done, which did similarly this morning. And that is again sort of looking at anyone who's expressing suicidal thoughts isn't doing it just to attention seek. They are doing it as a way of crying out for that little bit of help. They're looking for someone to listen to what pain they're under and sort of take that part on it. So similar to say as the last one, sort of starting to talk about it. These are the people who are a little bit more in tune with what they're feeling and are saying, look, this is happening to me. So it's more a cry for help and not a way of attention seeking. Whereas the next one, we're looking at suicide as selfish. And again, a lot of people see that as sort of looking at it, it's an easy way out for someone sort of decided that all the things that are going for them, it's they've been selfish, they've just thought about themselves and they've ended their life. Whereas that person has generally felt a lot regards what's going on with my life, what am I doing, what are the things that I'm causing, how am I doing this? And a lot of people who have survived suicide attempts talked about it being they saw it that this was the best way out to help everyone else, to help the family, to help the friends, because they felt they were becoming a bit of a burden on them. So when we get to that, the next sort of one is if someone decides to decides on suicide, there's nothing that can stop them. Suicide isn't inevitable. There are a lot of things that can come down and can sort of be addressed before someone can reach that suicidal act. So there are things that we can put in place. a lot of the time it's a case of we don't even know what things we're doing that could stop someone taking their own life. Just that little conversation, just that little "how are you today" is the thing that may stop them doing it, even though that person feels suicidal. But we can't always see them parts. It's not a case of sort of we're there, and it's easy to spot sort of thing. So there are, a lot of support. There's a lot of interventions from loved ones, from crisis teams that we have in sort of A&E departments and around mental health and sort of physical health GPs as well that can and help people with suicidal thoughts. Next one's looking at, as I sort of said, regards mental health. Only people with mental health disorders are suicidal. When we looked at the numbers, the first slide that we had 6,000 suicides in the UK in the last couple of years. Only around about 2,000 of them have been seen by mental health services. That's not to say the person hasn't got mental health issues that are being managed by the GP, or that this is a case of people who are only seen mental health services. So it's not a case of, it's just easy to say that because someone's suicidal, they've got mental health needs. There's a lot of sort of other issues that can be displayed within them. It could be sort of financial issues. It could be a sort of a loss of everything else. They feel they've got nothing else that they've got to turn for. Everything else has got changed in their life. There's a lot of things around someone's race, gender, that can also put pressure on them. So it's not just sort of that one issue. It's not just a mental health sort of issue. There's a lot of social impacts as well that are sort of a wider that we need to consider as well. The last one sort of we were looking at was you can always tell when someone's feeling suicidal. Obviously, that's a little bit harder to do. Sometimes we can, if people are saying that they need help, they're going to do this. We've already mentioned about people sort of trying to look like they're attention seeking and all that. It's not a case of we've got that. There's someone there who is asking for help, asking for support. There's those other people who we can see as sort of the life and soul of the party. Is always there, always seems to be the happy person, always seems to be the one that is leading the group, yet they take their own life by suicide and no one saw that coming for them. So it's not an easy fact that we can see someone who is feeling suicidal. And that's where we need to make the narrative now of getting people to talk and sort of getting people to discuss suicidal feelings, to discuss them parts that are stopping them from being able to openly speak and openly talk to everyone. And that's all attached to sort of the stigma around suicides. So as we look in this one of the first ones we look at is treating the taboo of suicide, how that we manage that, how do we start making that conversation a little bit more easier to have, a little bit more able for people to not fear as much that they're going to be doing something wrong, that there's as they approach and as they start talking about suicide, they don't need to be fearful of people misunderstanding them. They need to know then that we are able to accept that someone is suicidal at that time, that they are fearful for what things are going on for them, and sort of look at how we can change the risk factors in that person and sort of reduce them down and sort of understand a little bit more sort of what things we can do. But once someone dies from suicide as well, we have a problem or an issue where people then start looking at where they can attribute blame, especially if it was someone that you didn't see the suicide coming as well. We need, as human beings, as part of the grieving process, we need to understand, or we need to sort of say, well, that was because of that, that was because of this. If we can't see these things coming and we haven't been able to do anything, we then sort of need to look at sort of what way round we can understand why this person ended up taking their own life. And it's easy, it's then sort of a case of trying to find things for that because it becomes hard for taking that understanding. And suicide isn't an easy thing to understand. We can't simply simplify it into one cause. It was because of this, it was because of that. There's lots of contributing factors that may have come to fore before someone has taken their own life. It's been a case of these things have happened to them. So it's a mountain number of pressures or things on that person that they've just not been able to manage and feel able to discuss with other people that have come to the part of them ending up taking their own life. And that looks at then the person themselves and the stigma that they attach to the suicidal thoughts that they have. The potential is that they're internalizing that shame, that guilt of feeling like this, that they shouldn't feel these problems, they have a good life, or that things have been all right for them, or there's something that there's them sort of parts. Once that sort of ball starts rolling with that, we can then start looking at them. If they're feeling they've got this shame, they've got this guilt, they've got a weakness then because they can't find anything. They're not able to sort of be able to approach people and say, look, I'm feeling like this, because they don't know how to sort of feel confident enough to talk about it, because we've got that stigma, that taboo, that we can't talk about suicide. We don't want to hear what suicidal people are feeling, potentially in some cases. So there's that fear of being judged. There's a fear then of feeling less worthy than other people because we've got that part that we're just not able to talk, or we're just not able to listen, or we're just not able to ask that question. So there's a few barriers there to stop people seeking the help they need, because we're just at the moment we're not able to talk about suicide as easily as we can say about cancer. Now, 15, 20 years ago, cancer was very much a quiet thing. Everyone used to whisper about it. So and so's got this. We now got TV adverts saying support us with cancer. We need to move suicide into that sort of arena as well, where people are able to talk about it openly. So we're not reinforcing sort of a worsening mental health issue for people. We're not reinforcing negative behaviours. We're not sort of reinforcing the stigma around that act. And why that matters is stigma of suicide can leave someone feeling helpless and alone. They've got the fear and the shame of being judged because they feel they can't express the feelings that they've got, and they're not able to talk about their experiences. So it prevents them asking for help and the support that they need, that maybe around there and able to offer them, and to just bring them out of that little bit of a downtime that they've got and a little bit of support that they need. So when we talk about this and we look at sort of how we can change things around, how we can sort of discuss suicide a little bit more and change the way people live and the way people can survive in the future, we can look at sort of what difference we can do. And the first sort of part of that is the help seeking behaviour. So we've got a part there where people can link out, can start looking at sort of encouraging support so they can feel safe, how they can feel to act and support, get the support that they need. So there's the support and awareness then. Once we've got someone coming through and saying, we've got this sort of discussion going, we've got this support and understanding there for people, we can recognise what the problems are and we can support that suicidal person. Then we can start look then at helping to develop the support systems. We've got a lot in place already. We've got a lot of things that are there and running and are around for help for people, but we need to make sure that they're a little bit more well advertised and a little bit more available as well, and we can understand people's needs. We can make sure that they're well equipped to survive the suicidal thoughts, to survive around themselves. And with all that, once we've got these three parts, the final part that comes in is we develop a more compassionate society then where we're able to talk a little bit more about suicide because we feel able to understand when someone is seeking help, to know where the support is, and to signpost then people onto the help and the support that they need. So we've got all them parts that make it all into a whole and give us something a little bit more that we can make that difference. So the next one, we're going to do a little bit of a final poll. And again, this is sort of looking at changing the narrative. And what we're looking at here is sort of what three things you think you can do that can help change that narrative around suicide, and sort of what things are available. We got a couple of suggestions if you haven't got any. We've got the ones that say we've gone through a lot of these. So reducing the stigma, making it easier for people to talk a little bit about openly about the struggles, awareness and education, making sure that there's a lot more awareness around what suicide is, what sort of things are behind suicide, and the understanding of it, and then where people can seek help and encouraging people to seek help as well for if they're feeling suicidal. Again, stories of hope, recovery, if you've got any of them that can add to it. There's lots like the men's sheds around. You look at the support there that communities can offer as well, sort of the work that they can do to help men feel a little bit more part of the community and a little bit more able to put something into the community so they're not feeling as alone. And the last one, support causes. So if there's anything there, if there's anything more you can think of, we'll just keep that poll going for a couple more minutes. So that's my part done. I think we've got a couple of questions that are going to be, I'll hand back over to Zoe to go into the group.
Thank you, Steve. So we want to normalise having conversations about suicide prevention. So thank you again to our panel who have joined us today to discuss this topic and answer some of your questions. So we have had some through already. This first question, I'm going to direct to Alice if that's okay. So you recently shared some of the phrases that you find triggering to hear and see. Can you share a little bit more about this, please?
Yeah, sure. And hi, everybody. Good morning. So these are terms that are used quite regularly on social media and actually by some of my friends personally as well. So the one really that impacts me the most is after my friendship group have perhaps been on a night out, they've been to the pub, they've been to a club or whatever, and they've had some drink. And then the next morning they're feeling hungover and not feeling, great after a night of alcohol. And the terms that they use to describe themselves after that is, I'm hanging this morning. Now to them, that is completely innocent. They're talking about their hangover. They're talking about the fact that they don't feel very good following a night of alcohol. But to me, saying the term I'm hanging it takes me back, to be honest, to a very traumatic place. And it's not something that I feel comfortable listening to. And it really does make me seize up, to be honest, when my friends talk about it. Another one that I hear quite often in my day job, which again makes me freeze, is when really they're talking about projects and perhaps the project isn't going very well, they would say something such as, oh, I'm losing the will here. Again, completely innocent. They don't mean any harm by it, but it really does impact me because it's said so quickly and without really much thought for somebody who has been bereaved by suicide. Another one that I see on social media all the time, particularly regarding young people, is the phrase KYS, which stands for kill yourself. And this is used all the time on game platforms, social media platforms. If somebody perhaps has not done very well on a particular level on a game, somebody would very quickly say, oh, KYS. Again, they're saying it, in a light-hearted way, but to people who have been bereaved by suicide, that's really quite traumatic, and it's a case of trying to educate them about saying things with a little more thought, as opposed to just jumping in without any real thought really that goes into it. So I would say those are my main ones, Zoe.
Thank you, Alice. That was really insightful. Thank you. This one's open to all of the panel. So what tips do you have to help normalise talking about suicide?
Yeah, should I start? Morning, everyone. I guess one of the first things that occurs to me and that I've actually done myself is kind of openly talking about stress, struggles, really acknowledging that it's not surprising that you feel like that, given, everything that you're going through. So I think that's really important. Actively listening and really listening to what it is that people are saying, maybe looking for non-verbal cues as well. Sometimes people go, oh, I'm fine. But actually, when you look, you think, I'm not so sure, asking again. And then I suppose thinking about if you are responsible for a kind of company or an organisation or an education system, what have you got in place? What kind of policies do you have around sickness and things like that? How are we talking about mental distress, physical illness? Are we talking about them in the same way? And is there more that we can do to get, I guess, more flexible and compassionate really in how we're talking about things?
Yeah, I'd jump on the back of that as well, Claire, and also say that, a lot of us are using social media nowadays. If you do feel comfortable, share some of the experiences that you've had yourself. That might not be to a point of, experiencing a suicidal crisis, but it might be, as Claire mentioned there, some of the stresses, some of the pressures that you've been faced under in your life. Or also sharing other people's. There's plenty of celebrities now who have shared their experiences. Tyson Fury being a key example who's just come to my mind now. Sharing other people's experiences that of showing someone who was in distress and the steps that they've taken to come out of that crisis on the other side is what I would say.
Brilliant. Thank you for that, Andy. Does anyone else want to come in on that? Are you okay for me to move on?
Okay to move on. Thank you.
So the next question, again, open to all the panel. What can workplaces do to help support conversations safely?
Shall I start? No, go on,
Sorry, Claire. I was just going to touch on that one there. I think there's a number of different ways that organisations can really embed a culture of suicide prevention, mental well-being in general. There's a few things that spring to mind when I was making some notes yesterday. Return to works, I think, are really huge for people. If we think about some of the common drivers to what can cause someone to feel suicidal, things like bereavement, work stress, relationship breakdowns, these kind of things that would lead to someone having to take some time off work. I think that return to work process can be really important, and I think training needs to go into it. And organisations really putting a lot of time and effort into, even the processes around the documentation and asking them questions in there as well about someone's mental health and well-being rather than their ability just to be able to perform a role. Also asking about their health and well-being, asking about any suicidal ideation that person's had, any support that that person may need in or outside of work can be, make a huge difference to someone returning into workplace and identifying some of the signs early. I think training in workplaces is huge as well, from the top down. Sometimes a lot of organisations, they want to have a workforce that, is trained in mental health first aid, say, for example, but leadership teams showing initiative and leadership from the top down, I think could be really important. And final one I would say is also in workplaces, shared resources, intranets, these kind of things. Is there anyone on the leadership team or any employee that is willing to share their story and celebrate their journey, I suppose, through times of distress, just to keep the conversation going about suicide, about mental health in general. I think there's some really key ways that organisations can again embed that positive culture.
Yeah, no, thanks, Andy. I mean, only really one thing to add to that, which is around considering the conditions in which people work. You know, what are they exposed to? What support might they need? Things like often a lot of us are working in hybrid kind of settings now, aren't they? So thinking about, are people isolated? Opportunities to connect with colleagues and feel part of kind of, you know, the community, because I think it, you know, lots of people are working in different ways, building into appraisal discussions, which I think you touched on there, Andy, as well, you know, well-being and making sure that there is resources available for people to access. And again, I would say modelling, you know, modelling vulnerability, modelling, you know, everyone has life crisis and sharing stories. So
got just a couple of bits to add to that. So links back to what Andy was saying, that flexible working, I think, is a useful addition here as well. So just bearing in mind that people do have lives outside of work, and there might be some times where they need to be prioritising family and personal time, and making sure that we're building that into the work day where we can. Regarding resources, something such as an employee assistance program, or an EAP as it's often called. They often run counselling sessions for individuals as part of the program that they operate. So that's always a good thing to have in place. And I couldn't probably join this webinar without mentioning Ripple. So it's available for all businesses to deploy. It's a safety net that you can put in place. And it means that if any of your staff were to go on the internet and search for something harmful to do with self-harm or suicide, which sadly does happen in the workplace, then it means Ripple would intervene, interrupt the search, and instead signpost them to the resources that they can get support and help with. So deploying Ripple as well is a huge step that workplaces can take.
Brilliant. Thank you all for that. I'll just go on to another bit of a two-part question here. So how do we know what support someone needs if they share that they've been struggling? And with that, what advice do you have for best supporting that person with empathy?
Okay. I guess from a resource perspective, I'll come at this from my own experience of losing my brother to suicide here. So Josh was 21 when he took his life, and Josh had Tourette's, so he would find it fairly difficult to talk, especially to strangers. So looking back, if I was lucky enough to have had that conversation with Josh, I would have probably signposted him to services that didn't operate around the telephone, and let him know that actually there are alternatives available. So I think it's really important to note that it isn't just telephone support such as Samaritans that's available. There is also amazing support from the likes of Shout, which provide text support, Calm, where you can get support over web chat facilities. There's apps that you can download, like the Grassroots Stay Alive app, or the Hub of Hope by Chasing the Stigma, or indeed physical places where you can get support as well. So signposting them to groups, locations where people meet to get support. I think it's making them aware that there is a whole host, a whole plethora of people out there that want to help and support you, and you're not on your own. There's lots of people going through it as well, something similar. So that would be my input there to that one.
Yeah, just I mean, really helpful that, Alice. I think, you know, there is something about, you know, suicide prevention is everyone's business, isn't it? And there is health services, and there is a whole wealth of you know, services that are, you know, within communities that can offer something that really unique and a good match for what people are needing. The only things I would add really is around, you know, making time for someone, paying attention, like I said before, being curious, asking questions, and bearing in mind that that kind of suicidal despair, it is often as a result of struggling with problems that just seem unsurmountable. So trying to get alongside someone, trying to understand, what the difficulties and problems solve together, and normalize the struggle, really. None of us are exempt from struggle. So I think it's really important to normalize that.
And just to touch on that as well, Claire, I think a lot of us especially in personal circumstances when it's a loved one, it's a very close friend or even a colleague, and we might feel inadequate to be able to have these conversations. I think a lot of us take the pressure on ourselves to have to sort and solve the problem for the person. My advice would be let the person take the lead with that. A really important question that you can ask somebody who has opened up is, what would you like to happen next? And letting that person take the lead. Um, Ways around doing that and opening up that conversations, first of all, building a rapport. You might already have a rapport with the person. It could be a very close friend, family member, but also to create that safe space as a colleague as well is building rapport with the people around you. And then when having that conversation, you might have noticed some warning signs, something's not quite right. There's I'd say prepare and plan what you're going to do. A really good tool that I use with that is where, when, and how. So we're looking at the location, which is absolutely crucial. Thinking about it from a sensible perspective. When is also very crucial. If someone's about to go into a meeting or someone's about to finish work, to head on to kids, say, for example, that might not be the best time. But I'd say the most important part is the how. So what approach are we going to take? What language are we going to use? Again, what resources are we going to have accessible to us already to signpost? Alice mentioned the Hub of Hope. Absolutely fantastic resource that everyone can download on the phone or access on a web-based browser wherever you are in the country. So definitely, if you do take anything away from today, please download that resource and Ripple as well, as Alice mentioned, because the life-saving.
Thanks, Dee. So we want to normalize having conversations around suicide prevention. So we have our panel, Andy and Claire, who have joined us today to discuss this topic and to answer your questions. So we have been sent a few questions for this already. So the first question is, what tips do you have to help normalize talking about suicide?
Shall I go first? Afternoon, everyone. Thanks for coming along. I guess the first thing for me is just to acknowledge that I guess we're all humans and human distress kind of excludes no one really. So having those discussions with our peers, our friends at work, in a compassionate way, letting people know that they're of value, asking them how they are. And then there's things like, that kind of active listening, even practicing asking the question, how might you say it? How are you doing? Are you feeling okay? It sounds like you've got a lot going on. Just build those in generally. I guess if you're responsible for a kind of company or something like that, you might think about what policies and procedures do you have that are compassionate, that are thinking about people's well-being. In appraisals, are you asking about that? And in that kind of talking to someone, get in a confidential space, if you think, oh, they don't see themselves, sharing stories of kind of adversity, but also recovery and what helped. And you can use your own stories when you've struggled. Yeah, so I think there's just something about asking more often, really, and just normalizing that, mental ill health is as common as mental health, and none of us are exempt from it.
Well, thanks, Claire. Hi, everyone. Great to see so many people on the call this afternoon. I'll just touch on what Claire was saying there about your own story, your own experiences, or the experience of people that you know personally who have shared their experiences, or it could be celebrities. And I think a lot of people who will be on today use social media, different platforms that people use. And there's plenty of examples of people who have shared, felt brave enough, felt courageous enough to share their experience. And I think that can be really crucial for people identifying and relating to people just like them. It's something that I've done myself. I've gone through a suicidal crisis back in 2022. Very difficult to do, but I shared my own experiences. And on the back of that, I was very surprised about the people who I'd made a positive impact to, people who related to me. So what I was saying in terms of normalising it is normalising your own experiences. That might not be to a point of a suicidal crisis, but that might be things that you're struggling with. Be debt, it could be alcohol use, it could be different pressures and anxiety provoking things in our life. Or as I said before, sharing stories such as Tyson Fury comes to mind straight away, a celebrity who has been quite vocal about his challenges in his life and his suicidal thoughts that he's had. Celebrating these stories where people were in distress and are now in a much better place. I think that can really help to normalise the conversation about suicide.
Thank you. So the second question is, how can I provide a safe space and let people know that they can talk to me?
Do you want to start this one, Andy?
Yeah, can do. So I think it's absolutely crucial, isn't it? It can be really difficult, as it was mentioned earlier, to talk to loved ones, to friends, to colleagues. It can be really difficult, but there's some tips that I can share today that's worked well for me. Made plenty of mistakes also, so if you can cut my learning curve, that's a positive. But I would say the first, instance, it's always about rapport. And people, sometimes we have a natural rapport with someone based on the relationship that we've got with them. But I think in a general sense, say if it's a workplace or it's a particular social setting, we can start building rapport with people around us. That's getting to know people, letting people, get to know us within reason, whatever you're comfortable with. And once we've got that rapport, that first initial step into providing that safe space it makes it a lot of an easier transition for the person speaking to us. I'd definitely say, prepare and plan, how you're going to go about this conversation, this space that you're creating. And a tip that I always like to use is the where, when, and how model. So where, looking at location, that is absolutely crucial. I like to so when I have a difficult conversation with someone, I'd like to do that when we're going through a walk. We're away from people. There's also take us away from that intimate eye contact conversation, which can be quite intense for people. So location's crucial. When timing as well. If someone's about to go into a meeting, someone's about to finish for the day, that might not be the best time to create this safe space for someone. But understanding what time is best for that person is crucial. And probably so the most important part was the how. What approach are we going to take? What language are we going to use? What resources are we going to have available to us? What is the outcome that is desired from having that conversation? I think is really key in making us feel comfortable. Otherwise, it can go wrong and it can make us feel uncomfortable. We can stutter over our words. A lot of fears and our insecurities kick in. So there's some tips that I think would help in creating that space.
Yeah. Sorry, thought I was on mute there. Yeah, thanks, Andy. Yeah, I mean, just, ditto to all of that, really. I think only things might be perhaps what I said before, paying attention to non-verbals, when sometimes people really worry about if they say something that's going to mean, everything's going to be taken outside of their control, when actually, it's not about that at all. It's about, asking questions, tell me what's happening for you, really trying to understand what the problems are that people are struggling with. And then, trying to work together really and asking them what they need. Sometimes people might have a specific thing that they're struggling with. Sometimes it might be a number of things across a number of areas, and then just breaking that down. And very much, I think you mentioned earlier, actually, Andy, around, being led by them and kind of just working through what seems to be the biggest problem first and how you might tackle it together. I think sometimes feeding back observable kind of strengths and characteristics that you know about people, because people forget and people think that, you know, they've lost all kind of capacity to manage or deal with things when actually you can remind them of some of those things. So that's sometimes helpful, talking about when you've seen them succeed in something difficult before, and you know how they might kind of draw on some of those things that they used to get through. But yeah, that's all from me on that.
Brilliant, thank you. Another question we have is, what advice do you have for talking to children and young people about suicide?
Yeah, so I mean, I can start with that. It's incredibly complex, I think, suicide in general, because people, you know, get to that particular point for many, many different reasons. And I think when you're talking to children about suicide, there's kind of a number of key areas. It might be talking to children if they've lost someone to suicide. It might be talking to children if they're worried about a friend who might be at risk of hurting themselves, or they might be having some thoughts that they're struggling with themselves. So I think one of the things is about thinking about, you know, developmentally, what are they able to make sense of, you know, not making things too complicated, but sticking to facts, avoiding any detail, you know, around any kind of methods or anything like that. And then there are, you know, tips about how to be a good friend, how to talk to teachers, what they might do, you know, if they're concerned about somebody. And then there's some really helpful resources that I think, you know, we can put in the chat. Winston's Wish is a really kind of useful resource, helping you know, or talking to children about suicide and how to do that. There is, of course, papyrus and things like that are available to young people. And I think the bottom line is always listen to what it is they actually want to know, and don't minimize the seriousness of it, but don't amplify it either. So I think it's trying to get that balance. If there's anything to add there, Andy?
Real, yeah. So I made a couple of notes on, you know, if a question like this came up, and I think there's a couple of things that sprung to my mind. You know, language. You know, Stephen talked before a lot about language and the way the suicide is discussed, but thinking about our language and almost mirroring, or you know, sort of copying how the understanding or the capacity of the young person that we're talking to. I think asking for confirmation sometimes be really important. And an example of that would be if a young person uses language such as dark thoughts or bad thoughts. It's asking for confirmation from that young person, so we're not making assumptions about what that is. And that again comes from a mistake I've made in the past of assuming that it, you know, when a young person told me that it meant this, when in fact it didn't. And he only found that out a little bit further down the line. So I'd definitely say asking for confirmation about what they mean. Be patient as well. We need to understand that, you know, we're talking about children, we're talking about young people again, might not have the same understanding as us, you know, might not have won't have as many life experiences. So being patient, and again, you know, if we're having that conversation again with the young person that we know, you know, be brave, be compassionate, and be empathetic towards them. And again, you know, we're not always in a position where we have to solve the problem, but we can be in a position, be a really important person in that young person's life at that time. So definitely say there's a couple of tips there I would share.
Brilliant, thank you. We've got another question. So, what can be done to improve suicide awareness and prevent suicide?
Want me to go, Claire?
You can do. I missed the last bit that you said there. I was just wondering were you talking about workplace in particular or in general?
In general, but we
Oh,
can.
right. Yeah. Go on, Andy. Yeah, that's fine.
I think what you mentioned in workplace there, I think that's actually quite key to really, as an employer, as an organisation, or as an employee, you know, there's certain things that we can do to contribute to embedding a positive mental health culture, or you know, embedding a culture of suicide prevention from the top down. One thing that springs to mind there is return to work, something that I've had a really poor experience with myself in the past, and I don't think enough emphasis is placed on it by organisations. But if you think of the reasons, a lot of the reasons why people will go off in employment or go off in work, it would be stresses related to work. It would be, fears about becoming unemployed, bereavements, relationship breakdowns, mental health conditions such as anxiety. So when we think about these reasons why people will go off work, we know that a lot of them are risk factors for, causing someone to feel that they don't want to be here no more. So I think that return to work can be really important for organisations from a supporter point of view, but also from a process point of view, looking at the paperwork used rather than focusing on is the person able to do the job. It's more looking at it, can we support this person? I would also say just keeping in line with the organisation side of it is celebrating people who are in the organisation, celebrating people who have been in a really difficult time and willing to share their story. We can use resources such as intranets or local resources. Sharing training such as the Zero Suicide Alliance training that's being launched tomorrow. Sharing that around an organisation, and again, just keeping the emphasis and embedding that positive mental health culture, and wanting to create a genuine change, I would say, from the top down. So looking at leadership teams rather than a leadership team looking to get all the staff to complete it. Also take part in that themselves and embed that right up and down the organisation.
Yeah, thanks, Andy. Only a couple of things maybe adding in would be around looking at policies, which is kind of in line with the the return to work, but sickness absence, supporting colleagues, and even down to the wording of policies as well. That I think that's important. Making sure the language is compassionate. Things like incentives as well for staff around sharing some of those stories. So you might have team away days, you might just doing things like regular catch-ups. I'm really mindful, many of us work in kind of hybrid situations now post-COVID, and I think not underestimating the impact that can have on how isolated people feel. So what are we doing as an employer or organisation to try and create those informal chat-in spaces and opportunities to do things together? And again, back to, I think you may have mentioned it actually, Andy, but that kind of modelling in the discussions, you're sharing your own struggles, whether you're a manager, a peer, or whatever. It's normalising that adversity is everywhere, as is recovery, but just keeping those things open to discussion.
Yeah, I think as well, Claire, you're talking there, something popped into my mind as well, is I think there's been a bit of a move away from suicide just being a health matter. It's becoming more of a political matter. So as human beings living in our society, I think that's what we can all do. We can be aware of what's going on in our communities around us, the things I mentioned before, then financial pressures, relationship breakdowns, unemployment, these things are known to be contributing factors in people who go on and take their own life. So it's a responsibility that we can all take to find out what's going on, understand what the government strategy is around suicide prevention, what part can we play in that, in terms of reducing stigma, in terms of getting involved in campaigns. I think there's a lot that we can all do and take responsibility for that as a society moving forward.
Yeah, we could put that in the chat, actually, the new national strategy, just in case anyone's not aware of that. That was released kind of after 10 years, wasn't it? So that's really quite interesting to look at, see what roles we can play. So yeah, we could put that in the chat.
Brilliant. We've only got time for one more question. So this is, how would you recommend talking to someone who has attempted to end their life, but they have not spoken about it at all since?
What was the last thing you said there? Sorry, James.
Sorry. So how would you recommend talking to someone who has attempted to end their life when they have not spoken about it at all since?
Okay. Yeah, I think it's I'm assuming that the person kind of knows that they've attempted. Did they talk about it at the time? I guess is one thing you might want to think about. Did they share it at the time? The other thing would be revisiting it just in a general kind of how are you, you know, and just kind of mentioning that I know that's things were really difficult in the past. How are you doing now? You know, is there anything you need? Is there anything I can do? So you're just kind of keeping that space open without that kind of interrogation, because it may well be that actually they're doing quite well now, and they don't, that there isn't something that they're thinking about. But I think that general well-being check that we should be doing with all the people we know, really, and people we come across, it just opens that space up, doesn't it? And saying, you know, I'm here for a coffee if you ever want to go for a chat, or, you know, things like that, keeping it simple.
Yeah, I would also say, depending on what your situation is, but again, take that pressure away from yourself of having to solve the problem in this particular situation. We can be really helpful for the person, but it doesn't necessarily mean it's on us to solve the problem. I always link this to physical health, that if someone needed brain surgery, we wouldn't necessarily, you know, become a surgeon when we haven't got the capability. So I think being honest about that with the person, acknowledging our limitations in you know, in the situation. However, don't focus on that. Focus on what you can do and what you want to do. And I want to create that space in whatever language you use in order for you to talk to me about it. And again, keeping it with them, being led by them, what support would be helpful for them, if any. And can I support you to get there? For example, it could be James's place. It could be, you know, the Hub of Hope, which was mentioned on the earlier webinar. Having resources available to signpost a person to. But going back, I'd definitely say to acknowledge your limitations in that conversation, and promote what you would like to do and what you would like to get out of it for that person.
Brilliant. Thank you for that, everybody. That is going to be all the questions we've got time for today. We've made a note of everybody's questions that were submitted in the Q&A, and we're going to aim to answer all of those after the fact. So we'll be sending out some FAQ type things after the event with the booklet and the recording and such. So yeah, thank you again to Alice, Claire and Andy for answering those questions. Really value your experiences and insight there. We're now just going to talk about our suicide awareness training. So the ZSA first launched the suicide awareness training in November 2017, and we're proud to say it's been taken over 2 million times. Over the past few months, we've been reviewing and updating the training to include some new introductory content, new scenarios with a buddy that will also take you through the course. It's got a completely updated look and a new certificate. So we're now going to play a short preview of the training, just so you can get an idea of what you're in for.
The language we use matters because it conveys both hidden and explicit messages. We respond to words without even realizing it, and words can reinforce stigma. That stigma can stop someone from asking for support. Their words and actions can give you clues that they are at risk. Here are some warning signs to look out for. Talking about taking their life. Any talk about suicide, dying, or self-harm, such as, "I wish I hadn't been born," "If I see you again," or "I'd be better off dead."
Oh, Pip, that's not the case. We love you very much, and although you may not think it, I'm sure your friends care about you too. I think it would be good to speak to someone as soon as possible.
Pip recently came out as bisexual.
The LGBTQIA+ community can be at an increased risk of suicide due to potential rejection and discrimination. But
I hope there are still people out there who will take this opportunity and empower themselves and help each other.
You know, share it with someone, you know, go and have that conversation. I mean, you don't realise the difference that could make. For the person that's feeling that way, it's quite overwhelming. It can be quite scary. It's intense. But just by having someone just come along and just say the words, you know, be suicidal, you think about taking your own life. It breaks that. It breaks that, you know.
So that little preview there, as you saw, is from our redeveloped, updated training. So it will replace the existing suicide awareness training from tomorrow on our website. We are aiming to have the British Sign Language translation available in the coming weeks. So keep an eye on our membership communications if you signed up, and on our social media for some more information about that. So I guess our ask at the end of this webinar as well is just to take and share this training and support suicide awareness and prevention. If you do have any questions, please pop them in the Q&A function. We will do our best to get back to you. But as I said, all these questions will be used to inform our FAQs, and we'll share this recording from today's webinar as well as the ZSA website. And just one more thank you. We would like to thank everyone who has donated to the ZSA and just share a bit about what your donations help us do. So your donations help us train more people, increase suicide awareness through events and webinars such as this one that you're on today, challenge stigma, research and develop accessible suicide prevention resources and tools. If you do want to donate to support our work, we've shared some information in the chat, or you can scan the QR code that's on your screen now. So we'll give that a couple of seconds. And all that to say, thank you so much for joining us today. We really hope you found it informative. We are hoping to organise more webinars and would love to get your feedback. We've shared a link to our evaluation form in the chat, and we'd be grateful if you could spend a few minutes just sharing some of your feedback. So yeah, thank you very much, everybody.